I've gone through this whole very short menu. We don't really have, if you notice I didn't mention a couple of things. One which is by-mouth medications for reducing tone, which really have so many side effects that for a young adult who's trying to attend college or going to work, it really is not a reasonable alternative. And Botox injections are also a good adjunct to care when you're trying to improve physical therapy, but you don't have, it's not a long-term solution. It's a way of kind of invoking, making the diagnosis so you might be able to get to the other forms of care. If Botox really helps, maybe surgery is indicated. If Botox really helps, maybe the rhizotomy would help. If Botox really, So we come right back to this thing that right now, the closest we can get to the lesion, which is in the brain, is in the spinal cord. So we're getting a little bit closer to not just operating on the symptom, which is basically what I've done my whole life, because as an orthopedic surgeon I'm operating on a poor innocent tendon or bone. And in reality that's not the real problem. The real problem is, is the central nervous system injury. Because there's a kind of real prejudice among a certain cadre of pediatric orthopedists against rhizotomy. They feel somehow that it's bad surgery, ablative surgery, not indicated, and some of that I think comes about because of the typical. Typically, when procedures are introduced, there's a upswing in the popularity of the procedure. It'll be applied. It'll be applied for the wrong reasons, or for the wrong indications, rather, would be a better way of putting it. So that you say, okay, well, it's really good for the high-functioning, diplegic 4-year-old who's on the cusp of walking, and but then they say, well, what if it's not so high-functioning, and they're not really on the cusp of walking, and maybe they're a little low tone in the trunk, and we'll try it on that one too, and then we'll try it. So then, pretty soon you get too far afield from the primary indications, and you start having results that are really unfortunate in the sense that you've weakened the kid and not had any satisfactory result. So that's one of the reasons that people have doubts about the procedure altogether. But so you have to overcome that by looking at the current science and provide current information about what's going on. So that's why it's so important that we get done what I've just outlined in terms of the prospective, relatively long-term follow-up of patients, and to point out how the procedure can really help.